Better Health with Tripp Family Medicine. We're joined by Jeremy Daly. He is a physician assistant at Tripp Family Medicine here in Twin Falls. That's on Fillmore Street on the north side of the city across from the post office. And Bill Colley saying thank you for joining us. We're at 21, coming up on 8:34. Welcome back.
Thank you. Good to be here.
We were just having a non-medical conversation off the air, but it deals with a football star from your hometown.
From Pocatello, yes, sir.
Taysom Hill.
Taysom Hill, yeah.
And but who, by the way, has had some medical issues in the past, but I wouldn't dare get in his way. I'll put it that way. What are we talking about today?
Well, I thought, today would be a great day to have some of our callers bring their medical questions to the show and say, hey, this is what I've been thinking about. I've been worried about this. I was wondering about this, and we can discuss those topics.
Can I start out with a couple of my own? Because I had to go to one of the local department stores early on Sunday morning, really early, because I got up and realized my telephone, I didn't have any phone or text messaging on it. And then I realized I have an account that is debited once a month from my bank, but I had changed bank cards and forgot to tell somebody. So I got to the store where I have the plan through, and a woman helped me out, and she got on the phone and called the people that needed to be called. And then she said, okay, I'll hand it to you so you can give them a new card number and details. She had a terrible cold. And as soon as she handed me the phone, I thought, I can't be impolite. And she's helped me out. And so I took the phone. But as soon as I got off the phone, I thanked her. And I went to the bathroom in the store and then washed my hands. But I hate to say this, I don't mean to gross people out, but I washed at least the lower part of my nostrils out and everything else to try to avoid coming down with a cold, because I thought it's a short week for me on the radio. I want to get through it. And did I help myself in any sense doing that, or is this just kind of like a hit or miss?
Well, part of disease transmission is through respiratory droplet, especially viral illnesses. So, I mean, you can become sick just by breathing in the air that someone else is breathing out, or coughing out, or whatever it may be. But as far as washing your hands and making sure that you're keeping yourself, I don't know about cleaning the nose or not, but blowing your nose is a great way to get rid of a lot of those allergens and viruses and things like that get trapped in the nasal hairs and the mucus. And so yeah, I think that's a great way to take care of it. The biggest thing though is washing your hands. If people on a regular basis would wash their hands, especially after contact with other people, with doorknobs. I mean, we have so many contacts with our hands that I think we forget that there are, on a regular basis, germs everywhere, and we neglect to wash our hands.
Yeah, because this time of year, you got, and there's so much interaction because we're going to have holiday parties coming up. You're going to have people coming in and out of your homes, starting tomorrow for many people. You shake hands a lot at church, and this time of year people are coming in many times with colds and flu, and it just seems that it's almost impossible sometimes to escape it. But at least I'm going to guess the hand washing it gives you a fighting chance.
Yeah, well, and I would say that's the biggest thing that I do on a regular basis to prevent disease from being transmitted to myself. I have to stay healthy, and all of us have to stay healthy to take care of our patients, and so. Obviously, we're dealing with sick people every day of the week. Every day of the week that we're taking care of people where there's coughs and colds and the flu and strep, and we're in the same room with those people. And for the most part, we don't get sick. And that's, I would say, the biggest thing is the way that we're practicing good, basically hygiene, as far as making sure our nurses are really good about cleaning rooms after patients leave. I mean, they clean the doorknobs and they clean the beds and the counters, chairs, anything that's been touched. And then, making sure that we wash our hands before we get into the room, after we shake hands with the people, after we examine the patients, so there's a lot of things that we can do, but I think hand washing makes the biggest difference.
And I think I heard when one of these shows just about a week ago, when they were, remembering the 100th anniversary of the end of World War I, that the great flu swept through and killed a lot of the troops as well. But the instance of people actually dying who were caring for them, many of the victims were doctors and nurses who were exposed to it all the time. And it strikes me that you don't have any way to get around this. You have to face it. I mean, you can't go into another room and say, "I don't want to talk to that person today."
Right. So we know that's part of what we do. We know that we're going to be on the front lines, so to speak, of taking care of diseases, and people come to us before a lot of times they come to the emergency room and they go to the hospital. So we see patients that a lot of times need to be admitted to the hospital for whatever infectious disease that they have. So yeah, it is key. I mean, we obviously use soap and water on a regular basis and alcohol-based hand disinfection. Those are the big things that help to keep us from getting sick.
We'll talk more with Jeremy Dowley coming up in just a couple of minutes. It's 19, and we're coming up on 8:40. And you're listening to Better Health with Tripp Family Medicine. Bill Colley with you as well on News Radio 1310 KLIX and newsradio1310.com. Jeremy Dowley joining us in studio. He's a physician assistant at Tripp Family Medicine in Twin Falls. Joining us this morning on Better Health with Tripp Family Medicine. We're at 8:42. It's 19. Bill Colley handling the telephones, 208-736-0300. How do people get in touch with you at the office if they've got a question?
Well, we'd love to meet with them. Um, we're really excited to meet with new people. We have new patients most days of the week, depending on what our schedule allows. And so get a hold of us at our phone number 933-4400. Talk to one of our great front desk staff, and they'll get you in as soon as we can to have you meet with one of our providers, and we can talk about what your goals are for your health, and if you have any concerns, and everything from family history to preventative medicine to um, making sure that we help manage chronic diseases, which we do a lot of.
Now, you were here a couple of weeks ago and you were talking about the flu,
Mhm.
and I'm not so sure that we've seen a spike yet. I know you had seen the first case or so come through the office, but we've kind of drawn a because the weather has been, I think, better than probably most Novembers. People may not be as confined as they normally are, and so maybe that's going to help us out a bit. But still, there's that notion, and I've been reading up on a lot of this. Where I just read the other day where somebody mentioned that they had a healthy family member who was only in his 30s and he had the flu last year and died.
Uh-huh.
And that threw me for a bit of a loop. Not everybody who appears to be healthy in their 30s is going to have that level of complications from it. But
Sure.
but this is the serious concern I think that most people have is you can generally ride it out, but is it going to be one of those years where anything could be going on? Maybe you had something else in the past year that compromised your system, and you got to be concerned about this going into this time of year.
Yeah, really. I mean, you have to make sure that one, you're putting yourself in a position as far as the way that you eat, having good nutrients in your food. If you're depleted of nutrients, things like vitamin C and zinc and vitamin D, then your immune system's not going to respond as well as it should or it would otherwise if you were consuming those nutrients on a regular basis. If you're not exercising on a regular basis, then your immune system's not going to be as good as it should be. Um, and it's true that not every illness, not every virus, bacteria affects everyone the same way. Sometimes you'll have one member of the family that for some reason it affects them worse than everyone else, and it will get into their lungs and they'll get a pneumonia, and then sometimes they require hospitalization to be cared for in those cases. And we have a tough climate as far as healthcare goes. We have a lot of people who are in a position where they may be paying everything out of pocket for
Mm-hmm.
the first $10,000-$15,000 of their medical care, even with pretty high premiums. And so they're really uh, resistant, or they're concerned that, especially at this time of the year, that they take a family member into the doctor or the hospital, and they're going to have thousands of dollars of medical bills in just a few days and really set them back financially. And so there's a lot of concerns that people have about taking care of family members, but there's a lot of times where things like this happen. And a pretty recent case of a patient who was sick, and for the same reason, parents didn't have medical insurance, and it was a tough case. And kid got really sick, and It was a sad thing for us and for the parents to see, but it's just sometimes what we see happen. So be conscientious about worsening symptoms and people that look really ill. You don't just say, "Oh, they'll get better." Sometimes they need to be evaluated.
Sometime soon.
Yeah, and way better early on at a family medicine office than hospital or emergency room, right? Cost wise, it's going to be way less, and usually we can nip things in the bud early on rather than having to put on IV medications and you know oxygen and things like that on a continuous basis.
You talk a little bit about people who are going through some stressful times, and I think about those people who are in the shelters or the encampments in California because of the fires.
Hmm.
And in number one, they've breathed in a lot of smoke. Number two, they're now dealing with in some of the encampments the norovirus outbreaks
Hmm.
because again, they're probably all feeding in one joint spot, and you just do not have a lot of opportunities to maybe clean up and do those other things. Uh, Most of us will never be in that situation, but it shows you 2 or 3 weeks ago they were living in a nice home in a nice neighborhood, and now they're living out in a tent in the woods. And I've had the norovirus just once, and it was a very unpleasant experience.
Yeah, well, and that it wasn't a verified norovirus or the rotavirus or anything like that necessarily, but I had one of those infections come through my house a little bit over a week ago, and I was the lucky one in the family. I was the only one that wasn't infected, and I had uh, all four of my kids at one time get it, and wife get it, and everyone's sick and in bad shape. And I mean, it's a terrible place to be, even in the comfort of our home, but more so in situations like that. And I think it just goes to show a couple of things. One, the great quality of life that we have in the United States and that people enjoy on a regular basis, and that quickly, as you mentioned, that can change. You know, uh, some natural disaster occurs, and everything that you have is gone.
You speak about things changing quickly too, and I don't know if your office has had any questions about this, but there's been a strange disease on the East Coast that's been striking children that resembles polio, I guess was the understanding of it. There have been some deaths caused by it, but it seems to have mystified some people as to what might be causing this. At least those of the laymen among us who don't really know a lot about medicine. Any questions or comments come up about that in your office, or is that still geographically so far out that people pretty much haven't picked up on I guess their own radars here?
Yeah, I mean that's nothing that we've seen in our office or had patients give questions about. Um, and sometimes there's viruses that occur that we don't know what they are and why they're happening, and until it can be isolated by culture and grown out, then we don't know how to work with it.
It's 8:50. We do want to point out Jeremy Daly joining us on Better Health with Tripp Family Medicine this morning, and Tripp Family Medicine here in Twin Falls on Fillmore Street on the north side of the city. And we're at 21, Bill Colley as well, 208-736-0300. In some instances, these things will have an outbreak, and then you never hear anything more about them because they end up confined to such a small area. And then other times throughout history, you've just had all of a sudden that may even hold for a couple of months, and then there's just this explosion where a disease will suddenly go from being in just a small regional area and just suddenly something happens and the trigger happens and it just spreads everywhere.
Right, and you think about the global nature of business, and on a regular basis. I mean, I have patients here in the Magic Valley that are all over the world.
Right.
On a weekly basis, I'm having patients come in. I was in Europe last week. I was in Mexico. I was in South America. And they're everywhere, right? And they're in our office,
All jet lagged.
all jet lagged, and all over the United States for that. They're on a regular basis, multiple trips cross country throughout the week. And so, yeah, it doesn't take much. It doesn't take much to have someone in an airport via respiratory droplet or via contact, you know, uh, be infected with a virus or a bacterium and end up transmitting it from halfway across the world to our neck of the woods in no time.
We got to keep our heads on though too, because I can remember, over the course of the last 20, 25 years, I'd be working in newsrooms and you'd hear about flesh-eating bacteria, which
Sure.
is a media term, or then you hear about SARS, which was a disease that
Hmm.
popped up in Asia. And because it gets this media treatment where it's almost a drumbeat, especially with 24-hour news cycle now. So a disease that may be happening halfway around the world isn't necessarily, but it seems that for some people we're dealing with, um, that there's a moment where that fear increases, and I don't want to call them hypochondriacs, but we've got to remind people too that just every disease they hear about on a news broadcast isn't coming to get them.
Right. And I think it's the same ways that we prevent any other disease from being transmitted, whether it's the flu, whether it's the norovirus or the rotavirus, any of these other infections. You practice good hygiene, basically good protective hygiene. If you're sick, don't go to work. If you're, especially if it's something where you're coughing and hacking and you're exposed to a lot of other people, or you have nausea, vomiting, and diarrhea. I mean, those things are extremely contagious. And, you know, we all like to, and we talked about this a little bit earlier, Bill, you know, we all like to be at work. We all like to make sure that we're taking care of the things that we need to take care of. Because when we take a day off for illness, sometimes it sets us back. It makes it so we're, feeling like we're drowning in paperwork or whatever we're having to do, and so we push through it, being tough. Well, I've never taken a sick day in this many years and things like that. And the truth is, maybe you should have. And a lot of times that leads to less unproductivity. If you start to catch those symptoms and see them in yourself, know that you could easily pass those to other people. And so I think it's just being vigilant and being responsible.
Yeah, you were talking about vaccines a couple of weeks ago, and I know there are some people out there who question vaccines, but nobody is necessarily forced to take a vaccine. We're not holding people down and giving them vaccines, but just the medical advice is, in many cases, not a bad idea to get one.
Oh yeah, I mean, let's just kind of look at history and say what happened when there was no polio vaccine or smallpox, right? I mean, that was eradicated, but and we don't vaccinate for that. But I mean, we're talking about things that had huge effects on countries at a time,
Right.
and we don't deal with those. We don't deal with diphtheria on a regular basis. Even the measles, mumps, rubella type infections. Rarely do we see those. We rarely see chickenpox. I mean, I I can remember, you know, meeting with some physicians when I was training in them, saying, "Okay, this is what chickenpox looks like. You may not ever see this, but and then we saw a case of chickenpox, which, my goodness, I mean, 50 years ago, everyone had them, and so it's things like that. And people think, well, vaccines may have this or that side effect, but as a world community, I mean, we've
I,
we've prevented so many diseases, so many deaths, so many problems because of vaccines.
and I'm from, I think, the last generation of Americans who went through that period where I had the mumps and I had the chickenpox and I had the measles, and I you rarely ever hear about any outbreaks, and if they are, really they're very localized outbreaks that happen, and generally in communities where no one is vaccinated.
Sure, sure, and I often refer to this because it was kind of a personal experience. I was in a community down in Texas, Crane, Texas, when I was doing my training, and there was a big outbreak in that area, and a lot of it was due to people that were not vaccinating their children, and even the children that had been vaccinated, a lot of them were infected too. I mean, they maybe responded a little bit better to the infection, but they were still infected too, and they still had to deal with the whooping cough, and it was a bad deal. So you know, we quickly forget, I think, as a country and as people, the benefits of things like that. I think, like you said, your generation who experienced those things, you see the difference in what, maybe your children had to deal with versus what the children now have to deal
My
with.
daughter never experienced any of those things.
Right,
One generation removed,
right.
and that's the amazing part of all of this.
So, I mean, a lot of people have strong feelings for and against, but I mean, my recommendation is get your vaccines. It doesn't always, they're not always, as far as maybe some side effects from the vaccines, they're not always pleasant, but almost always it's better than whatever disease we're trying to prevent transmission of.
We want to point out we got about a minute to go. Contact information again at Tripp Family Medicine.
Yeah, call our office 933-4400 and talk to people, really good people. Get to know us on our website at trippfamilymedicine.com. You can read about our staff, each of us individually, and what we do as an office. And I think it's important. You need to get to know who you're going to trust with your health care.
Right. You're not a machine. You're human beings, and
Right.
you treat people like human beings as well.
Right. We like that because that's who we are. And yeah, you can get to know us on Facebook, and we try to stay active on some social media. We have Shalene taking care of those for us, but we'd rather you come see us. We'll get to know you and try to take care of you and your family.
And sometimes you actually, if you're driving through the neighborhood during the lunch hour, you see Jeremy coming back from a lunch excursion. So
Yep, going on a little bit of a walk.
seriously, he knows it's me when he hears the horn honking in the middle of nowhere.
That's right.
He jumps 3 feet in the air. I want to thank you for coming by today.
Thanks, Bill.
And we're coming up on 9 o'clock. We're going to talk model railroads. The new exhibit, or we should call it revamped exhibit at the Twin Falls County Fair, is all ready to go. We've got details coming up with some guests in just a few minutes on Magic Valley This Morning on News Radio 1310 KLIX and newsradio1310.com.